Leukemia. Leukemia is cancer of the blood cells. Normal blood is made of a fluid called plasma and 3 types of cells. 1. White blood cells. 2. Red blood cells. 3. Platelets. White blood cells, also called WBCs or leukocytes, help the body fight infection and disease. Red blood cells, also called RBCs or erythrocytes, carry oxygen from the lungs to the body's tissues. They also take carbon dioxide from the tissues back to the lungs. The red blood cells give blood its red color. Platelets, also called thrombocytes, help blood to clot when a person is injured. By clotting, bleeding is controlled and the injured person does not lose excessive amounts of blood. Blood cells are formed in the soft, spongy center of bones called the bone marrow. New, undeveloped blood cells are called blasts. Some blasts stay in the marrow to mature, while some travel to other parts of the body to mature. Normally, blood cells are produced in a controlled way as the body needs them. This process helps keep us healthy. When leukemia develops, the body produces large numbers of abnormal white blood cells. The leukemia cells usually look different from normal white blood cells, and they do not function properly. There are currently no known causes of leukemia. However, researchers have found certain risk factors that increase a person's risk of getting leukemia. Leukemia is commonly labeled by how quickly it develops and gets worse. In acute leukemia, the disease gets worse quickly. In chronic leukemia, the disease gets worse gradually. Leukemia can also be labeled based on the type of white blood cells it affects. Lymphocytic leukemia and myelogenous leukemia are 2 such examples. The following table shows the most common types of leukemia. Click on a type to learn more about it. Symptoms. Leukemia cells are abnormal cells that cannot do what normal blood cells do. They cannot help the body fight infections. For this reason, people with leukemia often get infections and have fevers. Leukemia patients often do not have enough healthy red blood cells or enough platelets. As a result, the body does not receive enough oxygen. Without enough red blood cells, the patient has a condition called anemia. Anemia causes patients to look pale and feel weak and tired. Without enough platelets, patients bleed and bruise easily. In chronic leukemia, symptoms may not appear for a long time. When symptoms do appear, they are generally mild at first and get worse gradually. Doctors often find chronic leukemia during a routine checkup before there are any symptoms. Some of the common symptoms of leukemia include fever or chills, weakness and fatigue, frequent infections, weight loss, swollen or tender lymph nodes, easy bleeding or bruising. Other symptoms of leukemia include tiny red spots called petechia under the skin caused by abnormal bleeding, swollen or bleeding gums, sweating, especially at night, bone or joint pain. Like all blood cells, leukemia cells travel through the body. Depending on where these cells accumulate, patients with leukemia may have a number of symptoms. If leukemia cells collect in the brain or spinal cord, the result may be headaches, vomiting, confusion, loss of muscle control, and seizures. If leukemia cells collect in the testicles may become swollen. Some patients develop sores in the eyes or on the skin. Leukemia can also affect the digestive tract, kidneys, lungs, or other parts of the body. Diagnosis. In order to diagnose leukemia, the doctor takes a detailed medical history and does a thorough physical examination. Blood tests also help in diagnosing leukemia. A sample of blood is examined under a microscope to see what the cells look like and to determine the number of mature cells and blasts. Although blood tests may reveal leukemia, they may not show what type it is. To check further for leukemia cells or to tell what type of leukemia a patient has, a hematologist, oncologist, or pathologist examines a sample of bone marrow under a microscope. A bone marrow aspiration is one way to collect a bone marrow sample. The doctor inserts a needle into a large bone, usually the hip, and removes a small amount of liquid bone marrow. A bone marrow biopsy is another way to collect a bone marrow sample. It is performed with a larger needle and removes a small piece of bone and bone marrow. If leukemia cells are found in a bone marrow sample, the doctor orders more tests to find out the extent of the disease. A spinal tap checks for leukemia cells in the fluid around the brain and spinal cord. Chest X-rays can reveal signs of leukemia in the chest. Treatment. Treatment for leukemia is complex. It varies depending on the type of leukemia and is not the same for all patients.